Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. We wanted today, first of all, to say I'm honoured to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honoured to be here on their lands today. I wanted to provide everyone with an update on yesterday's Walk-In Wednesday, which was, by all accounts, everywhere in BC, a very successful event. Yesterday, in clinics across the province, 33,277 shots were delivered, which is a significant number, up from previous days, but importantly, and this represents, I think, the effort to assist people in walking in to get their shots and focusing on first doses. 16,505 of those were walk-ins, significantly more, several times more than we usually get. The rest were appointments. That more than 80% of the 20,000 doses set aside for walk-ins were used, which we were very happy with. And of the walk-ins, 37.6%, or 6,130, were first doses. This, combined with the first doses that were done by appointment, made it one of the most significant days since really before Canada Day, our most significant day for first doses in some time. So it was a very good day, and for those of us, for Provincial Health Officer and Health Minister in a pandemic, yesterday was a pretty good day, at least as good as Thanksgiving in any event, Walk-In Wednesday. And we were excited to see around the province the effect of that, and you see that both in the numbers and in the response, especially amongst young people in many regions. In Fraser Health, they delivered 2,100 more doses than they had the day before, and heard about the convenience people had from being able to walk in to get their appointments and get their first shots in particular. Clinics in North Vancouver and Whistler were much busier than normal, while Squamish saw a great uptake in walk-ins. Interior Health delivered more vaccines yesterday to walk-ins than their regular scheduled appointments, and it was a very successful day and an important day in Interior Health. And on Vancouver Island, clinics in Comox, Cowichan, and Alberni saw a great uptick for walk-ins in people under 30 years of age. Yesterday was, therefore, a success, but there's obviously more work to do. As of today, we've done, in terms of vaccinations over the age of 18 in adults, 82.6% of adults are vaccinated, 70.6% have received both doses of a COVID-19 vaccine. Over the age of 12, those numbers are 81.7% and 68.4%. That's 6,965,062 doses delivered by the vaccination efforts in BC, by Vax for BC in BC, since we began our vaccination campaign in December. And so I encourage people who didn't get vaccinated yesterday or on previous days or need their second dose to do it today. They can register and book vaccine appointments. That's the best option to secure your dose. But for first doses, all of our clinics offer the possibility of walking in whenever they are open in BC, making getting vaccinated in BC easier than ever before. Today, for example, in Vancouver Coastal Health, they're at Kitts Beach between 12 p.m. now and 6 p.m., giving doses there. In Fraser Health at the BC Ferry Terminal in Delta, along in our work that we're doing with TransLink. On August 7th, we'll be in Surrey at the Fiji Islamic Center. Today, there's special vaccine appointments at the Killarney Community Center. Obviously, we're continuing to do with our work with the Downtown Business Association in Kelowna. We're doing the ongoing drop-in appointments at the Kelowna Yacht Club this afternoon. I encourage everybody in Kelowna who's not been vaccinated to go there today as well. We're at the Totem Mall in Fort St. John this afternoon, available for drop-in appointments there, and in Fort Nelson today, all through this afternoon, to get your appointments. In fact, all over BC. The message is that the message from the data, the message from what we're seeing, is that now is the time, if you have not received your first dose or you're able to get your second dose, you're eligible to get your second dose, now is the time to book your appointment or drop in to one of our centres around British Columbia. You can go to our website or just Google Vax for BC, and you can find the place to go and go. Yesterday was a successful day. I want to thank everyone, all of our healthcare teams across BC, all of our community partners who are part of this, all of the people working and volunteering at our vaccination centres, and all of you, people in BC, for continuing to get vaccinated at rates really as high as anywhere else in the world. This is the path forward, and we have to continue to press and push every single day. Today, if you haven't been vaccinated before, is the best day to get vaccinated, and we need to do it. The effort yesterday will continue to be repeated day after day as we find different opportunities to reach people and give them the opportunity to be vaccinated. But there is that opportunity today. It's important to do, and as we see significantly cases amongst unvaccinated people in our province, the need to get vaccinated is stronger and stronger every day. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. And I am just going to echo the Minister's comments in thanking each and every one of the thousands of people who chose to be vaccinated yesterday. You're doing your part for all of us to get through this pandemic. I'd also like to thank the many healthcare workers, the vaccination clinic staff, and countless others who worked all across this province to make yesterday the success it was. And I heard many stories. I heard stories from people who were concerned about going because they had concerns about getting needles. They were afraid that it was going to be too loud and noisy. And they were all positive stories about how our team was able to answer their questions, how they were able to get the vaccine easily and quickly and calmly, and people who needed to lie down to get their shot were able to do that too. And I just want to reassure everybody, if you have concerns, if you have questions, drop into the clinic. You can talk to our immunizers who've now had the experience of immunizing millions of people with this vaccines that we have available here in BC. And I want to reassure people again that we have been following all of the data on safety and effectiveness, and we can be confident that these vaccines are saving lives and making a difference. As we've been saying for many months, it's thanks to vaccines that we've been able to safely enjoy so much of what we have so far in this summer, and of course, to be able to see each other again. Even though Walk-in Wednesday has finished, our work to offer vaccines to every person in BC over the age of 12 will continue, and in the weeks and months ahead, there will continue to be quick and easy ways for you to access your vaccine across the province. So I encourage people to talk to those who've been immunized, to talk with their family and friends, to talk with your faith leaders about the importance and how you can get your vaccine. As we look forward to fall, though, we all need to be mindful that this virus is not gone, and we've seen that with the increase in cases that we've seen in the last few days and few weeks, particularly in the central Okanagan, where we see again that this virus can take off easily in people who are not protected. It's mostly young people, many who have not yet had the opportunity, there's many opportunities to be immunized. But now is your chance, and particularly as we head back to school, back to university come September, it's going to be more and more important for all of us to be protected so that we can manage this pandemic and move on with our lives. So now is the time. If you're a healthcare worker, if you're a student, if you work in the hospitality industry, we know how challenging it has been for you, and we have seen that this virus can transmit very easily in those high contact environments that you're in. Protect yourself and protect those around you, and that is how we are going to get through this pandemic. I do want to say that we are right now experiencing a surge, as you know, of cases, primarily in younger people between the ages of 20 and 40, and 95% across the province of people who are infected right now are unimmunized, or people who have not yet had their second dose. So that is important for us to recognize right now. That's the message that we have for you today, is that you are at risk, and you spread it to the people who are closest to you. We know as well in the interior, for example, in ICU right now, all of the people with severe illness in ICU are people who've not yet been vaccinated. And that reflects the fact that this virus can transmit even to some people who are partially vaccinated, who are older, who are more likely to have severe disease, or people that are part of your family or friends who may have underlying illness that leads them to be more at risk. We can't take those chances. Now's the time. Go in, get your shot, and thank you for all of you who have done your duty, your best for us to make us, help us get through this pandemic together. Thank you very much, and we're happy to take questions. Oh, okay.
Apologies, Dr. Henry. It'll just be 1 minute.
Okay.
We're good? Thank you for the wait, everybody. Apologies for that disconnection. We should be back on the line now. As a reminder for reporters on the phone, please press *1 to enter the queue. You will be limited to 1 question and 1 follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Penny Daflos, CTV News. Please go ahead.
Hi there. Thank you very much for taking my question. I just want to start out with one for a colleague. Quebec has just announced it will create vaccine passports and ban unvaccinated people from certain non-essential services like restaurants and concerts. The Prime Minister said he supports Quebec's move, and a new poll shows a large majority of the public supports it too. I mean, so you've said you support individual businesses doing this, but will BC consider following Quebec's lead on mandating vaccine passports for certain non-essential services? And if not, why not?
Yeah, so Quebec has been working on their QR code for some months now, and yes, I understand that in the fall they're intending to have some restrictions. We're looking at all options and continue to look at all options. What we have said is that we will not be denying people essential services based on their vaccination status. But I've also said very clearly that there are some services where people who work in those industries, and we think of healthcare as an essential public service, that we need to make sure that we are protecting healthcare workers, protecting the healthcare system, and the people that we care for. And so we are, as I've mentioned a number of times, working on our policy around that. And yes, you will hear more about that, but we are looking at all of the options for how do we best move through the fall, recognizing that COVID will still be with us, and we are also likely to see the other respiratory viruses that we normally see in the fall come up again as well.
Did you have a follow-up?
I did, thank you. Yesterday, BC had the highest COVID case count of any province in Canada. Epidemiologists are estimating that the reproductive rate of the Delta variant is around 6. They're saying that it likely can't be controlled by vaccines alone unless we get a really, really high vaccination rate, like 90% of the entire population or more. And yet in BC, we have few other control measures currently in place. So it's a twofold question. Are you at the point where you're just going to accept widespread infection of unvaccinated people? And also, what is your plan for handling the fourth wave?
Yeah, so I think you need to understand when you have rates, when you have low numbers and you do extensive contact tracing, as we're doing, and testing of people, it is expected that we're going to identify clusters of people who have been in contact with each other, and this reflects those transmission events that have happened over the last, week to 10 days. So yes, we expected that we were going to see increased numbers of cases, and we've taken additional measures in those focal areas where we're starting to see that high increase. We're also, as you know, have small clusters of cases in other parts of the province. But what we're not seeing, and that is what we have been monitoring very carefully, is we're not seeing the widespread transmission to people who are at risk that we've seen in the past, and that is because we have such high rates of immunization. And if you look at our immunization rates by age group, It's very high in the older age group, the people who are more at risk of hospitalization. And so there's a lot of different factors that go into what we need to do. We've taken additional measures in the areas, the hotspots, where we're seeing case rates rise, particularly in unvaccinated people. And yes, we are pushing very hard to make awareness that the important measure that we have now to manage outbreaks is immunization. So the modeling looks at a number of different factors, and we've been looking at the models as well. And we know that Delta is one of the factors. It is more transmissible, and that means that we need to have even higher rates. But even a small increase in immunization in different age groups can make a huge difference. So yes, we're following that carefully as well.
Our next question today is from Zhao Zhu, Globe and Mail. Please go ahead.
Oh, hi, Dr. Henry. So faculty and students at SFU has issued a letter today indicating concern about returning to classes without students being required to be vaccinated or masked. And UBC president says he cannot enact either of those without approval from your office. So with Delta variant surging, would you allow universities to bring in their own mask mandates and their own vaccination requirements? Thank you.
So this is another area where we've been working very closely with the post-secondary institutions about making sure we have the measures in place that are appropriate and that are needed in those situations to make sure that we can get back to in-classroom learning for young people. We know how important that is and how challenging it was, particularly for people who were starting their university career last fall. And so, yes, we are working very carefully with them. I did see the letter from SFU, and there are many important points that we are addressing. There are some that we'll need to continue to work with them on, but these are ongoing discussions, and we have the basics in place to make sure that we can have in-classroom learning across post-secondary institutions in BC, and we'll continue to work with them as we head into the fall.
Did you have a follow-up question?
Yeah, I do. Thanks. Dr. Henry just mentioned, you comment on the Quebec vaccine passport. And I'm wondering if standards are so different across the country, but Canadians are resuming traveling, how can British Columbians, even those vaccinated, be confident they're safe?
Yeah, you know, the most important thing is that the more of us who are protected through immunization, the more our community is protected. And we've seen that repeatedly. When we have high rates of protection through immunization in communities, the virus can't get a hold and can't spread as widely. That's what's going to protect us when people come traveling here, and we've seen that over the last few months. We've had quite a few weeks since we moved to that next step, where we've had quite a lot of visitors who've come in here to BC, and we've had people moving around BC. We expect that when we have more contacts, we're going to have increased numbers of cases, but it's managing those and making sure we identify outbreaks early, as we did in the central Okanagan, for example, and taking those additional measures when we need to. But really, our ticket out of this pandemic and protecting the ones that we're closest to, but also our communities, is by everybody stepping up and being immunized.
Our next question today is from Marcella Bernardo, News 1130. Please go ahead.
Hi, Dr. Henry and Minister Dix. Just wanted to ask you first off, you did mention that somebody else asked about post-secondary students and staff wanting stronger health measures this fall, but will you support mandatory vaccination rules and masks on campuses if that's what individual administrators at UBC and SFU and other post-secondary institutions say they want to happen?
Yeah, so that's a bit of a rhetorical question, Marcella. We are working with them to find out what are the best, most important things. I think what is critical, and I've said this repeatedly, is that we're not denying people an education because of their immunization status. So there's a whole bunch of factors that need to be taken into account there. One is where people are coming from, making sure there's access to vaccines at the place at universities, and we're working on those and how that can happen effectively and efficiently. And there needs to be provisions for people who cannot be immunized, even though they may be a small number of people, and provisions for what we're going to do in those settings when we have increased community transmission, which is going to happen in certain communities over this next fall. So all of those things are factors that are being taken into place so that we have adequate plans for all of the post-secondary institutions. And we're working with them on these right now. So it's not a simple question. It is something that we are looking at all of the different factors that need to be accounted for.
Marcella, did you have a follow-up?
I did. You both spoke very eloquently at the beginning of the news conference today about urging people to get vaccinated, but what is being done to crack down on rogue doctors and other healthcare workers who have been advising patients against getting vaccinated? Because we're hearing there are some people in healthcare that are telling loved ones not to get vaccinated because they don't think that the vaccines are safe.
Yeah, and that's unfortunate. Thankfully, it's a very small number of people, and that is something that I work with the college. We're talking with Doctors of BC, for example, to support people in getting accurate and knowing where to get credible information. And that's part of my role, is to make sure that we at the BC Immunization Committee provide the information that clinicians need to provide advice to their patients. And that's something we're doing across the province. I had a thought there and I've just lost it, sorry. One of the things that I will tell you is that the immunization rates in physicians in this province are in the high 90s, 96, 97%, and that really reflects the fact that as clinicians across the province, physicians are recognizing the safety and the importance of being immunized, and I can't reiterate that enough. We are watching very carefully all of the safety data. It's published weekly on the BC CDC website, all of the adverse events following immunization. We're part of the global effort to look at safety of these vaccines, and we've seen how effective that is in very rare events being detected and measures being put in place to ensure that we can find people who have those conditions. I'm thinking of things like VIT. So our safety procedures are in place. These are very effective vaccines, and part of what we need to do and what we're trying to do is to point people to where they can find that credible information that supports them in making those important decisions for themselves and for their own health.
And I think, as Dr. Henry has said, if you want to see what you should do, watch what doctors are doing. And in the high 90s, they're getting vaccinated against COVID-19 because they understand that that is important for them, important for their families, important for their communities. I want to say, though, that I think doctors have been leaders, and we see this in community after community. You'll recall we did a news conference here some months ago and talked about immunization rates in the city of Richmond. Richmond City Centre at the time lagged immunization rates across the Metro Vancouver area. Today, Richmond City Centre community health area has an 86.6% first dose immunization rate for all those over 12, significantly above the provincial average. And that effort was led by doctors in Richmond who talked to their patients, who talked to the community in Richmond, and made that happen. In my community of Renfrew-Collingwood, we have a 90.3% immunization rate, and that has been significantly due to the active participation of doctors and nurses and healthcare workers. And in fact, many healthcare workers live in my constituency, and you see those numbers reflected in Renfrew-Collingwood. I believe we can do that everywhere. And I think, while there may be some doctors or health professionals who are providing other advice, the massive majority, and in the 90s, in the high 90s, of doctors are recommending immunization, and they are an excellent source if you have questions and concerns to get answers from your family doctor or doctors in your community or nurses in your communities. Ask them questions, or pharmacists in your communities or health sciences professionals. Ask them questions about that you have about getting vaccinated. But I think our doctors have been real leaders in this, and I think the overwhelming evidence, in fact, is that they have been a massive plus in their the advice they give to people.
Our next question is from Craig Rasmussen, CBC. Please go ahead.
Hi, thanks for taking the question. This is for Minister Dix. I want to go back to this the Quebec vaccine passport proposal. And Dr. Henry said that she's concerned that you don't want to deny access to essential services for people, which of course is understandable. But what about requiring a vaccine passport specifically for indoor dining, bars, restaurants, large public indoor gatherings, that sort of thing? Would you support a vaccine passport for at least those activities? And if you could answer in English and French, I'd appreciate it. Thank you.
Juste pour dire, premièrement, que la province du Québec est en train de travailler sur cette question depuis quelques mois et ils n'ont pas, je pense, l'intention de mettre en place cette politique avant le mois de septembre, ou peut-être le mois d'octobre. C'est ce que je comprends de ce qu'ils ont dit aujourd'hui. Donc, on a annoncé encore une fois l'intention d'avoir un passeport pour les vaccins. Nous, en Colombie-Britannique, nous faisons une telle sorte de travail aussi, de faire en sorte que tout le monde va avoir accès facilement à leur propre bilan de vaccination pour que tout le monde puisse démontrer, s'ils ont besoin de cela, leur statut de vaccination. Donc ça, c'est le travail qu'on est en train de faire. Et on est en train de faire un travail sur toutes ces questions. Et donc, on va considérer ces options. Mais le travail continue. Ce n'est pas une question d'annoncer quelque chose d'avance, mais de faire le travail nécessaire. Et c'est ce qu'on est en train de faire en Colombie-Britannique, tous comme ils ont fait au Québec et dans d'autres provinces. In English, I just say that it's not my understanding that, of course, Quebec's been working on this question for some time, and they have the intention at some point in the future to implement a form of domestic vaccine passport. What we're working on in BC is making it easier and easier for people to access their own records because as a practical matter, not just for those who want to travel internationally, it will be important to have access to your own records. And it will be increasingly necessary in many workforces, in many forms of work, particularly in healthcare, to be able to demonstrate that you're vaccinated because there will be consequences if you're not. And those in long-term care, those announcements have already been made, and we're in the process, just as they are in other provinces, of implementing that. And so we are pursuing all options to address the transmission of COVID-19, and we're looking at all those options. Quebec has announced an intention to do something in the future. We're doing the work now to make it easier for everyone to have access to their vaccine record. There are a number of ways to do that now, which they're going to need. I would say to everyone that no, you are not obliged to get vaccinated in BC or anywhere else in Canada, but there are consequences if you don't. And I think everyone will have to understand that. But mostly, this is about hope and benefits. That all of the people who got vaccinated yesterday, the 16,000 people who walked up to vaccination centers, and more than 7,000 people who got their first dose yesterday, all of those people contributed to our joint effort to make BC safer for everybody. And in the same time, they made themselves safe. And they allowed themselves, perhaps in the future, if they want to leave Canada at some point to visit, whether it's Blaine or Bellingham or Belgium or Botswana, to go somewhere else in the world where they'll need to be vaccinated to travel. So I think we're working on and looking at all these issues. Quebec made an announcement today of something they've been working on for some time, and I believe they've talked about before. And we're working on all those issues as well.
Craig, did you have a follow-up?
Yes, my follow-up is for Dr. Henry, and it's about the Delta variant and young children. I'm just wondering if you have particular concerns, especially as we head into back to school and so on, about the Delta variant and its impact on children and through them spread to others.
Yeah, so we are watching, obviously, that really carefully, and as you'll see from the data that was posted this week on BC CDC, it's really Delta and Gamma these days that we're seeing most of across British Columbia, And that follows when you have clusters of cases that people tend to be associated with the transmission of the same virus from the same group of people. So it's not surprising that we're seeing that. What we are not seeing is increased rates of transmission in young children, and children under 12 in particular. We've not seen very many cases in that age group. So we are watching that, and as we go into the fall, of course, we'll be watching that as well. We have seen in some other countries where they've had an increase in younger children, but we've not seen that here. And we have a lot of experience about this virus in school settings, for example. So obviously we'll be watching what happens in the next few weeks, and the importance, of course, of everybody who is able to be immunized in those settings to be immunized. And now's the time to do that so that people are fully vaccinated as we move into the school season in September.
Our next question today is from Moira Witten, the Tyee.
Hi, good afternoon. Thank you for taking my question. We know that vaccination prevents serious illness and hospitalization, but recent data is showing that the severity of the Delta variant to cause serious illness could have a compensatory effect and cause hospitalization rates similar to the proportion that we saw in the previous waves of the pandemic. What level of hospitalized cases would cause a halt or regression in the stages of reopening that you've laid out? And is there a threshold at which you would make the decision to begin canceling surgeries or otherwise freeing up hospital space?
Yeah, so these are all things that are very much, again, in flux. The epidemiology is challenging to tease apart in terms of increased virulence or not from Delta. As we know, it's more transmissible, but it also is being transmitted in groups of people who are unvaccinated. So it's really hard to tease out if it actually does cause more severe illness, and we've seen this with every single variant that's arisen. It takes time to work that epidemiology out, and you'll recall the Alpha variant, when it initially arose in the UK, there was concern that it was causing more severe illness. Same with Gamma, the P1, same with Delta. So we are obviously watching that carefully, and our planning around hospitalizations goes back to the same type of planning that we've been doing all along through the pandemic. So we know how many beds we have, how many surge capacity beds we have for COVID. And the other factor that's in the mix right now is that we've seen, and we've talked about this in the last few weeks, we've also seen an increase in need for hospitalization and ICU care for non-COVID related issues that people may have been putting off for some time because of the pandemic, or that have been exacerbated through this last period of time. So those are all part of the modeling that we do on an ongoing basis to understand our capacity in the healthcare system. We're not at a place now where we are seeing that. We've seen a slight increase in hospitalization, but again, primarily in unvaccinated people in their 40s and 50s. So the younger people that are most commonly being infected right now with the Delta variant are not ending up in hospital for the most part. We're seeing a decoupling of the cases and hospitalizations. Having said that, those are things that we'll watch because we know it is a lag indicator as we move on into the fall season.
Did you have a follow-up question?
I do, thank you. You mentioned earlier that many young people, especially teens, are now just getting the opportunity to have their second dose or to have it after the province entered stage 3 on July 1st. Does this subsequent surge in cases, which many experts say definitively signals the beginning of a fourth wave, mean that BC's reopening went ahead too soon? And are you planning any major changes of course with further health measures being reinstated?
Yeah, so the short answer is no. No to both of those questions. We go back to the basic principles of how we've been managing this pandemic. The things that we're trying to do is prevent morbidity and mortality, so sickness and death, to prevent overwhelming of our health care system, because we know that affects not only people with COVID, but people with non-COVID illnesses that need health care. And thirdly, to reduce and minimize societal disruption as much as possible. There are downside impacts on all of us from some of the measures that were in place, even the measures that meant that we couldn't visit with family and friends. Those are important things, important considerations for us as we move through into recovering from this. There's no dichotomy between, the economy and our health. They both go together. We need people working. We need people in school. We need to have societal cohesion come back. And immunization gives us that ability to do that. It's not perfect, and we always knew we would see increased numbers of cases, particularly in people who are unvaccinated. And, I think if we look at models, if we look at all of the models that have been out there since the very beginning, they give scenarios that help us understand which are the important considerations. And the models that we are looking at right now tell us unequivocally the important indicators are even a small increase in immunization across the age groups makes a massive difference in whether we see a wave that is big or something that is more of a ripple. That's why we're focusing on the important things that we know make a difference right now, and that is being immunized. That's our tool right now that is working to suppress cases and to manage outbreaks.
We have time for one more question. Our last question today is from Mary Brooks, Island Social Trends. Please go ahead.
Hi, Dr. Henry and Minister Dix. So I'm looking at the over 7,000 people who got their shots yesterday, which is great. A lot of them probably first shots. And a lot of those people would be young adults, presumably, since they were kind of left to last in the queue. And so if they're going back to campus this fall, they're not eligible if the interval is still 8 weeks between first and second dose for getting their second dose until the beginning of October now. So how do the campuses, how are they expected to handle having a partially vaccinated student population? And also, when the students do want to get their second shot, do they have to go through the registry? Is that how it's going to work now, and they wait for the call? Or do they just show up at another clinic 8 weeks from now on their own volition?
Yeah, so there's a couple of things in that question that we can unpack. Part of them is, we are looking at what is the best interval for supporting going back to school in the fall, and we are modeling how we can do that. As you may know, we've talked about a few times, we've had a huge number of people who have been eligible for their second dose in the last 3 weeks. And so we're coming over that curve now. And so that gives us a little bit more flexibility with the amount of vaccine that we have now to adjust that interval if we need to, particularly for hotspots. For example, in the Okanagan, the central Okanagan, we're moving up the eligibility, have moved up the eligibility so people can get it at 28 days or more after their first shot. That means that we can get more people fully protected as we know that the virus is circulating in those communities. So we're looking at that across the province, and we'll be making some decisions about that in the next few days about where and who should get the vaccine sooner in the next little while for a variety of different reasons. And that will help us as we're going into September and, in the end of August as people are arriving to go to university. In terms of how people are going to be able to access it, those are things that we've been working on as well with the post-secondary institutions, and especially for the larger ones, we need to have vaccine available at student health services within reach of students' access very easily on campus, and we're working on those as well.
And Mary, did you have a follow-up question?
Yes, just briefly then on shots that have a shortened interval, regardless of what age the person is who gets that, is there more of a concern that a shorter interval shot is ultimately less protective in terms of vaccination than if they've waited what you originally had hoped would be 11 weeks as the ideal?
Yeah, so that was another really great question, that's something I've been consumed with for a number of months, as you probably know. What is the optimal interval? We still don't know that for sure, but there is increasing evidence that having at least 6, 8, 10 weeks between doses, if you're able, probably gives stronger and longer lasting protection. So for the vast majority of people in BC, that interval has been at least 7 weeks or longer. And I think that is one of the reasons why we're seeing such good protection in settings like long-term care. But it is a balancing and a bit of a, and some would say a race in some ways, between protecting people with 2 doses when there's a lot of virus circulating in the community and getting that extra bit of cell-mediated protection that you probably get if you extend the interval a bit longer. So it is different for different people in different parts of the province. Right now in the central Okanagan, it's much more important that we get most people with the second dose as soon as possible because we have a lot of the virus circulating, relatively lot circulating right now. But for most of us in areas where it's not circulating, it's better to wait a little bit longer if you can. So those are all the considerations that we've been working through with our BC Immunization Committee, and we'll have some more information about that as we analyze what's happened this week and as we go get closer to the fall. Did you want to say?
And that's all the time we have for today. Thank you,
Thank you
everyone,
very
for
much.
joining.